Hi, my name's Cindy Farr, and I'm the Missoula City-County Health Department's Incident Commander for our COVID-19 response in Missoula, Montana. This is Friday, March 20th, and this is my daily briefing for the press and for the public. Not a lot has changed as far as cases in Missoula County since yesterday. We still have 4 positive COVID-19 cases. None of those cases require hospitalization, and they are all recovering in isolation at home. We want to take this opportunity to remind people of the things that you can do to protect yourself and other people that are in vulnerable populations in our community. So cover your cough, stay home if you're sick, keep your kids home if they are sick. We would encourage you to continue to practice social distancing measures, which means trying to stay at least 6 feet apart from other people if you have to sit in meetings. Avoid congregating in large numbers. Those are the ways that we can help slow the spread of COVID-19 in our community. So we just want to continue to remind people to practice those measures. We've had a lot of questions this week about health officer orders. Our health officer has issued 2 orders this week. One was to close restaurants and bars, and the other was to close gyms and theaters. So the questions that we've gotten is how are those decisions made? So when our health officer has to make a decision to order a closure, there are certain things that she takes into consideration. So those things are, what are the priorities? Who are the populations that are at highest risk? What are the downstream effects? And if you close something, at what point do you get to reopen? So the priorities in this case is that we know that the most vulnerable people in our population, those over 65, those with chronic health conditions, and those who are immune compromised, are the ones that are at most risk of having bad outcomes from this disease. So it was really important for us to think about, how might those people contract this disease? And the easiest way for this disease to spread is when you have a lot of people congregating in large numbers. And that was part of what made the decision, how she made the decision to close restaurants, bars, gyms, and theaters. We also have to think about what are the downstream effects of that? We know that this affects your daily life. It is a disruption for people, and we completely understand that. Um, and so when we have to make a decision to close something, then she has to consider, what are those effects? How much is this going to affect the economy? How is it going to affect the workforce, essential services, child care options, the supply chain for food or for supplies down the road? So those are things that we definitely think about as she's trying to make the decision of if we're outweighing the risk versus benefit when it comes to closing something. The other thing that we really have to think about and that she has to weigh is, how do you rescind the order? How do you open things back up? This is one of our biggest questions, since this is a new virus and we don't have the tools that we really usually have, like if we were thinking about pertussis. A big thing that we have to recognize is that if we close things, when things reopen, does that mean that we're opening the door to introducing COVID-19 into our community? So I just wanted to clarify some of those things that we do have put a lot of thought, and Ellen puts a lot of thought into this before she makes a decision to issue a health officer order. Another thing that came up today is that the governor actually issued a similar order, but it actually restricts a lot of other things. So his order includes restaurants, bars, casinos, health clubs, pools, spas, performing theaters, bingo halls, and several other establishments. The full list of that can be found on our website at missoula.co/cvirus if you have questions about that. His order actually is good through the 27th, and his press release states that he will likely extend that order when we get to the 27th. So his order includes the things that were included in our health officer's order, but is expanded to a much broader number of establishments. We appreciate the concerns of the citizens, and we don't make any of these decisions lightly. That said, businesses, organizations, and citizens do not need a closure order from the health officer or the governor to take measures to protect people in our community. We appreciate that some businesses have chosen to close or deliver services differently in order to prevent the spread. And those who have complied with closures and orders to date, we just want to say thank you very much for your compliance. We are all doing this for the broader good of our population and trying to prevent and slow the spread. So if you're concerned about places that aren't closed, you need to evaluate your own risk and make those decisions for yourself as to whether or not you want to put yourself in those establishments based on what your risk is for the disease. And other people, like businesses, you can also take into account what you think the risk of the disease is to your staff and your employees and your place of business, and make those decisions to close voluntarily if you're not included in one of the orders that have come out this week. We do want to just keep reminding people to try and practice those social distancing measures, see if there's a way that you can deliver services in a way that is maybe different than what you've been doing, but would still accomplish the ultimate goal that you have. And we do understand that there are some people that are not going to fit into that category, and that those services are not going to be able to be delivered in a different way. So you should just take the precautions that you can, and remind your staff that if they're sick, they should not be coming to work, and watch for those symptoms of fever, cough, and shortness of breath. Those are the things that we're really looking for when it comes to COVID-19. We have also had a few questions about whether or not people can spread the disease before they start having those symptoms. There are some studies that are coming out showing that a test can be positive before the symptoms are actually developed. And what I want to just make really clear is that just because the test is positive does not mean that you are actually able to spread the disease at that point. Sometimes the test can be positive because we're really early in the course of the disease and the viral load is very, very low. And then as the viral load increases in a person's body, at that point they start having more symptoms. And so they might start coughing or having shortness of breath. And because this is droplet spread, then the coughing is what is transmitting those droplets into the air, and that is what is causing the spread of the disease. So that's why we're most worried about people who are having those symptoms of cough, shortness of breath, and fever over 100.4, because at that point, that's when a person is most contagious. We also do have a request from our nursing staff that if you interact with our nursing staff, please just remember that we're all working really long hours and we're trying to do the best that we can to protect our public's health. And it's really important to just be respectful and understand that they are basing what they're telling you on the guidance that we are getting from the CDC and from our state health department. So I'm just putting that out there for people that, we are getting a lot of questions and a lot of calls, and we just would urge everyone to just be patient with us as we try to all get through this together. So with that, I think that's it for my daily update, and I will see you all on Monday unless something really big happens over the weekend. And if it does, you'll be hearing from me then. Stay healthy, everyone.